And today we are going to do nurses and non-nurses. We are going to find out, okay, nurses and non-nurses who are kind of smarter, okay. We are going to find out um, who is actually smarter. There will be some questions, okay, and um, these questions actually look very easy, okay, but I would like you to answer them if you think you are smart. All right. So I will try to go out of the screen, but I will still keep talking so that you can hear my voice. Okay. Let me see if I can keep it here. And I can stay this way a bit. Okay. So let me go. Let me okay. All right. So the first question that we have is if you know it, you can just put it down on the comment section, and we would discuss the answers. Okay, later. So the first question is or keep your own score. Like if you are a healthcare professional, just comment um, team nurse or doctor or whoever you are, just comment team healthcare, okay. And if you are a non healthcare professional, if you are not a nurse or any doctor or anyone, just comment team public. You need to comment team public, okay. And this is round one. Round one is who comes first in the medical team. Who comes first? Number one, four patients arrive. Who needs assessment first? Okay, number one, broken wrist, pain 9 over 10. B, temperature 39 degree. C, severe difficulty breathing. And D, vomiting twice. Who would you come and Shivam who says severe difficulty breathing? Wow. Let's see if other people, someone else would comment and answer before we move on to the next question. Let's see. Hi, hi, Shivam. Thank you for your comment. Are you a healthcare professional or are you team public? Because we are we are doing this competition like kind of who is smarter. Are you among the healthcare professional or are you team public? You are a non-healthcare professional. Can you identify so I know where you are coming from? What from where you are, answering from? Are you a doctor, nurse, or you work in the hospital, or you're just like a non-healthcare professional? Okay, you are an Indian nurse, or you are just someone that has no background in nursing. So because I want to know how a non-healthcare professional, how much they know about all these health-related questions, brain teasers. Are you a nurse, or you are just you don't know really nothing about nursing or about healthcare? So let's see. Um, so your answer. Okay. So Wow. Okay. So you know much about, you have the health the health background. So the medical background. So it's good. So yes, the answer of this question is C, breathing, because breathing compromises take immediate priority. Okay. So let's go to the other question. Okay. Let's go to another question. Let me put it up. Let's go to another question and see. So this is the second question. Okay. So the second question is, um, sorry, Shivyam, you can give yourself 1 point. Okay. So at the end of the day, at the end of this life, we'll see who has the highest point. So the second question is, which symptom requires the most urgent assessment? A, mild headache. 2, B, new facial drop and difficulty speaking. C, constipation for 2 days. D, ankle pain after walking. Who, which symptom requires the most urgent assessment? Which symptoms requires the most urgent assessment? Which symptoms requires the most urgent assessment? Who is going to answer the question? If you're coming in new, just write team nursing or healthcare, like team health or team non-health, team health or team non-health. So let's see again. Let's see. Let's see. Let's see. Um, let's see. Shivyam is taking the lead this night. Shivyam is taking the lead this night. So Shivyam is taking the lead this night. Anyone else have any answer? A different answer or the same answer? You can put it on the comment section. Any answer? Do you think is the right answer B? Shivyam said it's B. Do you all think is the right answer, or you have something different? Shivyam, why do you think it's B? Can you tell me why you choose B? New facial drop and difficulty speaking. Why do you think it's B? Just write in the comment section why you think the answer is B. Why do you think the answer is B? Why do you think the answer is B, Shivian? I'm waiting. Why do you think it's B? Shivian, why do you think the answer is B? Why is it not any other alphabet? Why is it not A or C or D? Do you have any reason to back up your answer, please? Do you have anything to back it up? You want me to help you? Why do you think The answer is B. So, okay, I'm gonna help you here. So the answer is B. So the yes, true. The correct answer is B because sudden facial weakness and speech difficulty can indicate an acute stroke and require emergency assessment. Okay, because stroke is an urgent um, thing. Like you need to treat the person, you need to attend to the person urgently. If not, the brain cells, okay, starts dying. All right. So that is the correct answer. So you can give yourself, I would say, is it a half point or a 1 point? I think it would be, let's do it. I'm going to give you 1 full point now. But next time when you answer a question, you need to tell me the reason why you chose that question. Okay? You need to state why you chose um the answer, not just a number. Okay? So let's go to another question. Let's go to another question. Okay. So this question is um question number round two now we are. Okay. So it says normal adult resting heart rate is generally 20 to 40 BPM, 60 to 100 BPM, 110 to 150 BPM, or 150 to 200 BPM. Which one is the answer? Which one is the correct answer? So if you don't know, I am a nurse. I am a charge nurse working in Malta. Okay, it's a very nurse paradise, and I'm here live. And I am currently living and working in Malta as a charge nurse. So that's why I am bringing this kind of brain teasers and let's learn all together. So, um, the question is normal adult resting heart rate. What is the normal adult resting heart rate? No cheating, guys. No cheating, okay? Try to answer the question. This one, you don't need to give the reason. You can just say A or B or C or D. You can just send the message. Just send on the comment section. Is it A or B or C or D? Which one is the normal adult resting heart rate? Can you please answer? Nursing students are also welcomed as well. If you're a nursing student, if you're a medical student as well, you can answer. Normal adult resting heart rates. Hi, we are doing nursing and healthcare um, healthcare versus non-healthcare. Who is the smarter? So, um, the heart rate for a resting, the normal heart rate for adult resting is B, which is 60 over 100. That is the normal adult resting heart rate. Okay. All right. So the answer is B. Let's go to the next question. Let's go to the next question. So the next question is nurses versus everybody. Which organ primarily filters the blood to produce urine? Which organ primarily filters the blood to produce urine? A. Lungs. B. Stomach. C. Kidneys. D. Pancreas. Which organ? Which organ is the duty? Is the duty of this organ to filter our blood to produce urine? If you're coming in new, we're doing nurses versus everybody. If you are a nurse or you are into health, just write in the comment section um, healthcare or whatever profession you are. And if you are none, just write everybody on on the comment section so that we would know from where, like, from which background you're answering from. So, which organ primarily filters the blood to produce urine? If you know the answer, just write on the comment section, please. If you know the answer, just write on the comment section which organ primarily filters the blood to produce urine. Which organ primarily filters the blood to produce urine? Hello. Okay, yeah. So the correct answer is C, the kidneys. The kidneys. The kidneys. They are the organs in our body that work to like filters the blood to produce urine. Okay, so let's go to the other question. So this question is, what's the largest organ of the human body? What is the largest organ of the human body? The answer is practically in front of you. The answer is practically in front of you. The answer is practically in front of you. What's the largest organ of the human body? What is the largest organ of the human body? What is the largest organ of the human body? The answer is practically in front of you. What is the largest organ of the human body? Anyone can answer this question for me, please? Anyone can answer this question? What's the largest organ of the human body. Yep, the answer is B. The skin is the largest organ in the human body. Okay, let's go to the next question. So, this question is, a patient suddenly develops chest pain, sweating, and shortness of breath. What should happen? What should happen? Okay, a patient suddenly develops chest pain, sweating, and shortness of breath. What should happen? A. Tell them to rest and check later. B. Urgent clinical assessment stroke escalation. C. Give them food. D. Ask them to walk around. As a nurse, or in as everybody, if you're not a nurse, what do you think you can do? You can them to do. What do you think you can do? Choose from the answers below. Which one is the appropriate um, action you need to do? a patient suddenly develops chest pain, sweating, and shortness of breath, what should you advise the patient to do? Hi everyone, it's your favorite Nurse Paradise here, and we're doing Sports the Danger. We are sporting the danger. If you wrote down B, you are correct. So the correct answer is urgent clinical assessment stroke escalation. That is the correct answer. Let's go to the next question. So this question is, which is a possible sign of severe allergic reaction? Which is possible sign of severe allergic reaction? A. Airway stroke tongue swelling. B. Mild hunger. C. Dry elbow. D. Hiccups. Which is the correct one, please? The correct possible sign of severe allergic reaction. Which is which is a possible sign of severe allergic reaction? So the correct answer is A. The correct answer is A. So I'm gonna go to another question, okay? So this question is: a conscious adult suddenly cannot speak, cough effectively, or breathe after eating. What's the major concern? A conscious adult suddenly cannot speak, cough effectively, or breathe after eating. What's the major concern? A. Migraine. 2. Choking, airway obstruction. C. Fever. D. Dehydration. What do you think is wrong with the adult? What do you think is wrong with the adult? A conscious adult suddenly cannot speak, cough effectively, or breathe after eating. What's the major concern? So the answer is B, choking slash airway obstruction. Okay, that is the correct answer. Let me go to the next question. What has a heart that doesn't beat? What has a heart that doesn't beat? What has a heart that doesn't beat? So it's B. The answer is B. Let's go to the final question. What gets wetter, wetter the more it dries? What gets wetter the more it dries? The answer is towel. Okay. answer, just write in the comment section, okay? Let's play this game together.